on the 6s.
Okay, thanks, Brooke. And we've got Congressman Brian Bilbray on the line right now, live from Washington, D.C. Congressman, you were in the House last night. Let's start with this public option. Apparently still on the table, according to the President. He claims it would be self-sufficient and not cost the taxpayers a dime. What do you think?
Well, I think that that's a big challenge. And I hear now this morning that his proposal is to have an automatic cut on other programs and haven't identified those. I think that we need to identify where the savings is going to come from. And he was talking about a $900 billion price tag over the next 10 years. But got to remember, the next 10 years, there's only 5 years of this program in there. So that $900 billion or $1 trillion is really only a 5-year cost factor, not a 10-year, because you've delayed it. It's a typical Washington. They juggle the numbers always to be able to try to make things look better.
Now, in watching this debate last night, obviously you see half of the room standing up and clapping, and then half of the room kind of crossing their arms and down. But there were more details that did come out, however, not a real list of particulars. Were you swayed in any way after the speech? I mean, were you surprised by anything?
No, I was kind of excited about one thing that I've been talking about at all our town hall meetings, and that is, why force a choice to the consumer between big business and big government? What about the co-op? What about the credit union model? The one part of the financial service programs that really kind of weathered the storms was where you allowed individuals to get together and cooperatively provide services. Why don't we do that with our health care? And the president, finally I got somebody in Washington listening, and the president actually proposed that may be the much more viable alternative than having the federal government come in with a program. And I think that is going to be sort of the determining factor of who really wants to have a single payer, who wants a government-operated system, or who really wants to give choice to the consumer. And I think the co-op is one that has been so successful with our credit unions that we ought to look at building on that. So I was kind of excited on that aspect of it.
Okay, so maybe we're starting to find some common ground here. So maybe the speech is effective in those terms. To some degree. Now, we noticed something very interesting here.
You did. You picked up on it, didn't you?
This number.
Isn't it interesting how numbers change
47 million Americans uninsured. Well, then last night it suddenly became 30. Who are the 17 million not included in that number anymore?
Well, I think the fact is the president believes that there is a guarantee in all these bills that illegals will now not be able to get any of these services. The trouble is the president obviously is not aware that in the committee, when they were drafting up the House bill, the Waxman bill, there was a motion to require that you check through E-Verify, the same system the president is mandating all contractors use from now on starting this month. That was voted down, that basically they said, well, only legals get to use it, but you're not allowed to check to see if someone's legal. And you know, Mark, as well as I do, that unless you check to make sure that somebody is legally in the country, you're going to have illegals lining up on this issue because they all know the system. I mean, our hospitals have been impacted severely on this. So that's where the number really comes from. And it's interesting how that was thrown out and how that number changed. And that's obviously was a conscious number that was being changed, and they were trying to retreat from the 47 million that included the illegals, and now they're trying to back off.
And just one more thing before you go, just about this this heckling incident from Representative Joe Wilson from South Carolina. Yeah. Where were you? What did you think of that?
Well, I think it was inappropriate. I think that Joe was. I almost had a feeling like the president was not talking about the House bill that Wilson was talking about. The president's probably talking more about the Senate bill because the president kept saying my bill. He didn't say the Waxman's bill. He didn't say the House bill. And I think that the president was talking more about what he thinks is going to come out of the Senate because obviously Mr. Wilson knew, because he had been involved in the process, that the ability for illegals to get health care under the House bill was wide open. And I think he had a burst of emotion when he said, wait a minute, just because you say something doesn't make it so. And I think that was the misunderstanding because the whole time I heard the president talk, I kept hearing him talk about my bill. He wasn't talking about the House bill, and there was a big difference.
All right. Congressman Brian Bilbray, is always great to hear from you. We'll see you when you're back here in district, all right?
Absolutely. You take care of yourself, okay?
You too.
All right. Thanks for joining us this morning.
All right. For more information, you can go to san diego6.com, click on Hot